Hello and welcome back to my channel. I'm Dr. Anne, and this space exists for the questions many people feel embarrassed, unsure, or even dismissed for asking, and for the conversations doctors like myself are having quietly behind closed doors every single day. Now today we're talking about perimenopause. Yes, perimenopause. And this talk isn't just for the ladies, it's for everybody out there, because it's very important that we understand what perimenopause is. We all have a mother, a sister, a daughter, a friend, a wife, a colleague that's gonna go through perimenopause and eventually menopause. So it's important for you to know about this. Don't think I'm too young, I'm too old, or I'm the wrong gender. It's something for every single one of us. So sit back and let's talk about the hormones. Now, ladies, have you ever caught yourself thinking, why do I feel anxious all the time? Why am I exhausted but still wide awake all night? Why does it feel like I'm just not coping the way I used to? And maybe you don't say out loud, maybe you barely admit it to yourself, but somewhere in the back of your mind, a quiet question keeps coming up. And that is it my hormones? Yes, if that question has crossed your mind, I want you to hear this clearly. You are not alone and you're not imagining things. Today, we're talking about perimenopause, what it really is, why it can feel so chaotic and overwhelming, and most importantly, what you can actually do about it. So let's begin. What is perimenopause in plain language? Let's start at the beginning, because this is where so much confusion and frustration begins. You see, perimenopause is the phase of life just before menopause, when your hormones, especially estrogen and progesterone, start to change. So menopause itself has a very specific definition. It's when you've gone 12 consecutive months without a period. But perimenopause, that can start years before that point. For many women, it begins in their late 30s or early 40s, and it doesn't last a few months. It can last anywhere from 4 to 10 years. And here's the part that most women are never told. During perimenopause, hormones don't gently decline in a smooth, predictable way. They fluctuate, they surge, they crash. One month, you might feel almost like yourself again. Then the next month, you barely recognize how you feel and the emotions that are taking place. So instead of a gentle downhill slope, it's more like a hormonal roller coaster. And that unpredictability explains so much. It explains why symptoms can feel random, why you might feel fine one week and overwhelmed the next, and why blood tests can be misleading, especially early on, because you can have hormone levels that look normal on paper and still feel absolutely awful in your body. So blood test doesn't always give you the answers. So why does perimenopause feel so overwhelming? One of the biggest misunderstandings about perimenopause is the idea that it's just about periods or fertility. So estrogen doesn't only affect your reproductive system. No, it plays a huge role in how your brain functions, how you regulate emotions, how you sleep, how your body uses energy, how you control temperature, and even how your joints and muscles feel. So when estrogen starts to fluctuate, the effects are system-wide. This is why perimenopause doesn't just show up neatly. You might present with anxiety or insomnia or low mood or even weight gain or brain fog. And instead of being connected back to hormones, those symptoms are often dismissed, minimized, or treated in isolation, which is why so many women say, I just knew something wasn't right, but I couldn't explain it. So what are the signs and symptoms of perimenopause? This is the part women usually recognize themselves in most. So let's take it gently and honestly. We first have psychological and emotional changes. So for many women, these are the earliest and most distressing symptoms. You might notice anxiety that feels new or suddenly much worse, low mood, a loss of motivation or enjoyment, panic attacks that seem to come out of nowhere. You might feel irritable, snappy, or even rageful, and then guilty afterwards. Your tolerance for stress feels much lower than it used to be. You may feel emotionally fragile, overwhelmed, or like you've lost your confidence. You see, a lot of women worry, am I losing control? Is something wrong with my mental health? Sometimes there is a mental health condition alongside this, but sometimes hormones are a major part of the picture. Now let's talk about the sleep changes. Sleep disruption is incredibly common. You may struggle to fall asleep or wake in the early hours, often around 3 a.m. or 4 a.m. with your mind racing. Night sweats can wake you up suddenly, and even after a full night in bed, you wake up feeling unrefreshed and exhausted. You see, poor sleep alone can worsen anxiety, mood, weight gain, and brain fog, so it quickly becomes a vicious cycle. Now let's talk about brain fog and cognitive changes. This one really frightens people. Forgetting words, losing your train of thoughts, struggling to concentrate, finding multitasking suddenly exhausting. For women in demanding jobs, this can feel terrifying, but it is very commonly hormone related and it is very real. Now, what other physical symptoms are there? You may experience hot flushes or night sweats, palpitation that feel alarming, headaches or migraines, aches and pains in your joint or muscles, persistent fatigue, changes in your skin or hair, vaginal dryness or discomfort. And then we have metabolic and body changes as well. Many women tell me, I'm eating the same, I'm exercising the same, but my body feels different. Weight gain, particularly around the abdomen, loss of muscle tone, feeling less resilient after illness or stress, becoming more sensitive to alcohol or caffeine. These are all changes that you can experience as a result of perimenopause, and these experience is real. What about menstrual changes? Well, periods may become heavier or lighter, cycles may shorten or lengthen, you might miss periods, or your premenstrual syndrome symptoms can worsen. And it's important to say this clearly. Your periods do not need to stop from perimenopause to be happening. So what can we do about perimenopause? What can you do about perimenopause? Because support during perimenopause should always be individual. No two women experience it the same way. So the first thing is hormone replacement therapy, also known as HRT. HRT works by replacing hormones your body is no longer producing consistently. For many women, it can significantly improve hot flushes and night sweats, sleep quality, mood and anxiety, brain fog, joint pain, and vaginal symptoms. For some women, HRT is genuinely life-changing, but for others, it may not be suitable, and that's okay. That's why an informed discussion with a medical professional matters. HRT isn't one single medication. There are different types, different doses, and different ways of taking it. Risks and benefits must always be weighed with your doctor. Now, if HRT is not an option, there are other medical options available. Depending on your symptoms, your doctor may consider local vaginal estrogen, non-hormonal treatments for hot flushes, or treatments for anxiety, depression, or sleep difficulties. Perimenopause doesn't mean everything has to be treated hormonally. So this is where we talk about lifestyle and self-support. You see, lifestyle changes don't replace medical care, but they do support it. This includes prioritizing sleep, strength training to protect muscles and bone, adequate protein intake, reducing alcohol, learning stress regulations rather than trying to eliminate stress entirely. So these lifestyle changes do make a difference. So try your best to put them to practice. Now, many women explore supplements as well, but please hear this. Natural does not mean risk-free. Always speak to a doctor or a pharmacist before starting supplements, especially if you're already on medication. So when to seek medical support, when to see your doctor. You can speak to a healthcare professional if your symptoms are affecting work or relationships, you feel persistently low or emotionally unsafe, you have sleep deprivation that is ongoing, or you no longer feel like yourself. You deserve more than just reassurance, you deserve support. If you've been watching this and thinking, this explains so much, then this conversation matters. Perimenopause is not a personal failure, it's a biological transition and one that deserves understanding and proper care. If you have questions, experiences, or symptoms you'd like help making sense of, leave comments below. If there's a topic you want me to cover next, then tell me. If you want clear, honest, no-nonsense health information, subscribe to the channel because your health really is in your hands and knowledge is power. Once again, I'm Dr. Anne and I'll see you in the next video. Bye for now.